Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so that you live fully while enjoying doing what you love. So today is going to be a little bit different from the other episodes. If you're listening for the first time, typically we talk about health topics and give practical tips. So you can watch our previous episodes on many different health topics. But today, I'm going to be talking about the direct primary care model. And that's because I've been getting a lot of questions about this model lately. And that's the model that we practice at In Touch Primary Care. I had 3 different people ask me this week, what's the catch? It seems too good to be true, but it's true. And you can hear what our patients are saying. And I look at our Google reviews, and in general, direct primary care patients are very happy with it. So I wanted to share a little bit more about it so that people can understand what it's about. So I'm going to share key points about how it's different from the traditional care option and how many individuals, business owners, international visitors, 1099 contractors, how they've benefited from this care. This model exists all over the country. So if you're not in the Houston area, you can look it up, direct primary care, and you can find a primary care practice near you that can provide services. So if you're frustrated about not being able to reach your doctor when you need it, or if you're frustrated about having to wait weeks to get an appointment, or have to wait days to get a medication refilled, or just sitting in a waiting room for a long time and you're wondering, why is it taking so long? Or you're wondering, I have insurance, why am I paying so much out of pocket? Well, stay tuned. I'll be answering a lot of these questions. But before I get into it, I do have one announcement. I'll be hosting a webinar this Saturday at 12 noon. So this Saturday is Saturday the 17th at 12 noon. And we're going to be talking about how to avoid weight gain during the holidays. So you'll be able to ask questions directly afterwards. So if you're interested in this topic, go ahead and register. The link is going to be provided. And you can just go ahead and register for the webinar this Saturday at 12 noon. We're going to be talking about how you can prevent weight gain during the holidays. So you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, which is a direct primary care or membership clinic in Sugar Land, Texas. And I am so excited you're here. If you're seeking a much more proactive and convenient approach to your healthcare, then come join us. You can learn more at www.intouchprimarycare.com, and you'll hear more about that today. Remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Please share with someone that might need it. You never know, it could make a huge difference for them. So, why is it so difficult to reach your doctor in the traditional care system? And how is this different in the direct primary care system? Well, why? Well, the way the traditional care system is set up, the practice is actually incentivized to see as many people in as short amount of time as possible. So the way the payment structure is set up, the practice gets paid better if they see, for example, 4 or 5 people in an hour instead of spending that 1 hour with you. So obviously, since that's how they keep the lights on, they're going to try to get the 4 or 5 people in that time. So that's one of the reasons. The other thing affecting it is the way insurance companies, there are rules about how they operate. And there are different rules for different ones, but for the majority of them, your doctor can only see you during a visit. That's how the doctor gets reimbursed for their care. So they have to document a visit and submit it in a certain way. Otherwise, it's not counted as a visit and they don't get reimbursed. So what that means is even if you have a simple question that could potentially be answered over the phone, well, if your doctor spent all day on the phone, they would never get reimbursed for anything that they do. So in order for you to get seen, you have to go ahead and come in or have a video visit with your doctor. And that's taking up space because everyone needs an appointment instead of separating it out to those that really need an appointment and those that don't. So if every single person needs an appointment all the time, you can see how it's going to be difficult to get to have time, right? So they're going to have to rush through appointments so that everybody that needs it can get one, and those that don't need it get one too, because that's the way you get reimbursed. But that's good for the practice, right? Because the more people they see, the more they're reimbursed. So that's that. So when a patient has to see 18, and when a doctor has to see 18 to 30 patients a day, they don't have time to answer questions and messages in between. And I believe really that not being able to reach your doctor easily really makes it difficult to prevent serious health conditions, which is the whole point of primary care, right? So how is that different in the direct care model? Well, the direct care model, like what I practice at In Touch Primary Care, it's a model of care where the people become members of the practice, kind of like a gym membership. And basically, we're out of network with every insurance. So everyone pays a flat annual membership fee. They can pay it monthly if preferred, but that gives them access to their own personal doctor for the year as long as they're enrolled. And as a primary care doctor, we can take care of 80 to 90% of healthcare needs. So in the direct primary care model, we limit the number of people we see. So instead of seeing thousands of patients in our panel, we see hundreds. Most practices will have, upper limit of like 600-700 patients, which is much different from a traditional care model, which is 2,500 and above, right? So at In Touch, once our panel is full, people go on a waiting list. So at the fact that our patients can actually, we don't see as many helps. And also the other big piece is that we're flexible in how they can interact with us. So with insurance, that's not a possibility because of all the laws surrounding them, but the laws prevent easy communication. And so in the direct care model, you can text, you can call, you can email your doctor directly. And since it's all under a flat membership, it doesn't matter how many times you do that. And so because there are many different ways to reach us, it's not that we're working 24/7, it's because there are multiple ways to reach your doctor. Patients can get what they need very easily, very quickly. We don't have to make an appointment for every single thing. If something can be sorted on the phone, we can do that. If something can be sorted via text, we can do that. If you need a video visit, we can do that. And so by having multiple ways to reach your doctor, it limits how many people have to actually come in. And so we have room for when the people come in, we have time to be able to spend with our patients, which is huge. We have time to listen, we have time to talk, get to really know you, get to answer your questions and make sure that we're taking good care of you instead of just kind of rushing you through. So that's a big difference when you compare the direct care model to the traditional care model. So this easy access is huge. It's not only that it's convenient, it saves time and money. So as a member, a person can come in as many times as they need. No co-pays, no deductibles, no co-insurances for the visits. And since it's an annual flat membership fee, no questions about how much it's going to cost. The prices are very transparent. So for example, this week I had a patient with a rash. We talked over video. I was able to send medications within minutes. That was done. Another one texted questions about a medication. I was able to clarify it. They didn't have to go on Google to find out the answer. That was done. I had another patient a few weeks ago that was exposed to the flu and had flu symptoms. He was out of town. We're able to get him sorted and he was fine. So by having multiple ways people can reach you, you're freeing up the in-person visits, number one. And then number two, people are getting their questions answered in a timely fashion with the same doctor. You don't have to tell your history to yet another person. You don't have to be worried that they may not know that you're on this medication and then they gave you the wrong antibiotic. And then now you're having interactions. There's all these things that could happen when you are not seeing the same doctor who already knows you and can continue to take care of you. So having that access with your own doctor makes a big difference. So easy access is also very helpful so that people don't end up in the emergency room unnecessarily. I've had patients that have chest pain that was acid reflux, or I had another couple patients that had severe joint pain that was gout, but because they were able to reach me directly and have their questions answered, they didn't end up in the emergency room unnecessarily or in the urgent care. We were able to take care of it. So that also saves our patients lots of money. Okay, so I think many people get the point. Easy access to your own doctor who knows you, who can consistently take care of you, saves you lots of time, lots of money. Now, the other question I said I was going to answer is why, for people that might be wondering, why am I paying so much out of pocket even though I have health insurance? Well, here is why. It's important to understand that health insurance is different from the other types of insurance that we know. For example, when you need to service your car insurance doesn't pay for that. Or when you wash your car, you pay out of pocket for that, right? Your car insurance doesn't pay for you to wash your car. Or even if you need to fix something like a light, they don't pay for that. Same with home insurance. You use your insurance for big events, for the accidents, for the home floods, for things like that, right? But with health insurance, they've made it so that you can use your insurance for everything. Things like primary care. Primary care is really to help you stay healthy, to prevent things. But by doing that, that means that there's a justification for a higher premium. So your premium is going to be higher because now they're saying they're doing more, right? So that's the thing. And also it comes with a lot of paperwork because every insurance has different rules. When a practice takes insurance, then you have to hire more people because now you need a biller, a coder, a front desk person. So the overhead is higher. And so the cost because that insurance piece is there, it makes healthcare more expensive. Now, this insurance piece is important. I don't want you to go away from here thinking, oh, I don't need insurance. But what I'm trying to say, so please hear me, you need insurance, but the way insurance is being used, especially in the primary care setting, makes it difficult for people to reach their doctor, makes it difficult for doctors to, take care of the patient in the way that they should in the primary care setting. So insurance is useful, definitely, because if you're in the hospital or you have to go to emergency room, you need a surgery, absolutely. Those are, very needed, just like if the car, you're in a car accident or you have a home flood or something. Those are great times you want to have insurance, but for your 90% of care, which is primary care, a lot of times by adding that insurance piece, it just makes it more expensive and inefficient. So that's the point, but don't take my word for it. If you have doctors in your family or you have doctors that are friends, just ask them about what they feel about how the insurance helps their situation, and they'll tell you. A lot of doctors are frustrated about the way the system is set up right now. So, like I said, with direct primary care, it's different. It's under a membership model, like a gym membership. So people pay for annual membership or subscription, right? But many of the patients I have health insurance, or at least a health plan, and they can use those plans outside of the practice. And it ends up saving them money because they know exactly what they're paying outside of their insurance. It's not guesswork. So for example, people that have a high deductible plan, I've had several patients that have like a $10,000 deductible, for example. It's very unlikely that you're going to meet a $10,000 deductible in a year. So that means every time you go to your doctor outside of your physical, you are paying out of pocket. That out-of-pocket cost often is not a fixed cost, is a cost you find out about after the fact. And sometimes it's a very surprising out-of-pocket cost, or the bill that you get from the lab. Well, where that person benefits in our membership program is they've already paid the flat membership fee. They can come in as many times as they want, and that doesn't affect their, so they know their cost is fixed. And then if they need to do labs, that's a very, very discounted cost for that. So they have access to take care of 80 to 90% of their healthcare needs for most people. And if something else comes up, they have, the plan to help cover that. So that's great. And then for people that have health sharing plans, the health shares a lot of times incentivize people to actually pair with a direct primary care practice. And many plans give their clients a discount when they join like a practice like ours, because it actually lowers their overall costs. So as a member, no questions asked about how much you'll be paying every time you get to the doctor's office. You're not scared about getting a bill 2 to 3 months later. No co-pays, no insurance, no deductibles. And if something changes, like say you're switching jobs or you're starting your own business, it doesn't make a difference. You can continue to see us. Or let's say you don't have insurance anymore, or you now have insurance, you can continue to see us. You see the same doctor over time, which really helps to improve. Studies have shown improves your quantity and quality of life when you have a primary care doctor. So membership is huge for business owners, either those that have employees or those that don't, because they can offer their employees something. You can now offer your employees some kind of health plan, and that helps them to be competitive. It helps them to retain good talent. It helps the business owner, because now their employees can reach the doctor easily and get better sooner, so they can come back to work quicker. So it's a win-win for employees, a great model for business owners, either for themselves or for themselves and their employees. And they can add on an insurance plan if they want. Also very beneficial for international visitors. So a lot of international visitors don't have options for health care. They may, for example, not be eligible for Medicare, and finding affordable health care can be very difficult. So, or even if they're visiting for a short time, they can come in our practice. They have access to the low-cost testing and access to a personal doctor. It makes a big difference for them. Or it could just be anybody that, wants a more personalized care. They want to be able to reach their doctor. They want to know somebody's listening. They want to know that they're being heard. They're not being rushed. They want to be able to ask questions. They want someone that's proactive about their care. So our practice works well for that. So those are just a few key differences when we compare a direct primary care practice like ours versus a traditional model. And there are so many more benefits. We don't have time to get to it today, but particularly at my practice, in Touch Primary Care, I am also a lifestyle medicine doctor, which means that I work with patients to reduce medication use. So I focus more on lifestyle changes to treat health conditions. So our members have that additional benefit that they have, a doctor that is knowledgeable about lifestyle options for them. So I'm going to stop here. And there's more information about our practice on our frequently asked questions page on our website, or you can call our number, or you can email us, or you can schedule a 15-minute meet the doctor on the website. And if you have questions or just want more information, go ahead and contact us in one of these ways. And if you're in the Houston area and you're looking for a doctor that is proactive about your health, if you're tired of the current health system, and you just don't want, you don't have any health care, you don't need to delay your care. Please check us out at In Touch Primary Care. I've shared some of the ways we're different from the traditional practice. And so you can learn more on the website, www.intouchprimarycare.com. And remember, your health is too important to rush. It's too important to ignore. You need help to enjoy doing what you love. So prioritize your health today. Okay. And thank you for watching. And I'll see you next week at the same time, 2:15 on Wednesday. Take care.